Hello, and welcome to this guide to the CDRC resources available in EMIS to help with identifying and managing patients who would benefit from lipid optimization. First, I will show you the suite of searches that have been developed. Once you've imported the searches via the zip file on the CDRC website, you should see a list of searches like this. There are hundreds of interlinked searches to accurately identify patients requiring some sort of assessment or intervention. To avoid confusion, there is a dedicated CDRC lipid strategy folder that can take you through a stepped approach to managing your practice population. The first step is ensuring your practice disease registers are up to date. This is particularly important when reviewing indications for primary and secondary prevention. And as you can see, there are numerous case-finding searches for various chronic diseases. Step 2 is about identifying patients who may be eligible for primary prevention, in which a formal CVD risk assessment is required. A search has been created to identify patients with a possible Q risk of 10 or more, but in whom a calculation of risk has not been made and coded. This search has been broken down into those who are called for a chronic disease annual review, an NHS health check, or those patients who are missed from both of these cohorts. Step 3A and B align with the AHSN standard operating procedure for primary care lipid management, with tiers 1, 2, and 3 identified for focused activity to be started. These patients are likely to be eligible for lipid-lowering therapy already. As with step 2 searches, these searches are broken down into those who will be called for a chronic disease annual review, an NHS health check, or those patients who are missed from both of these cohorts. Once identifying a patient for assessment, you can use the CDRC Lipid Management template from the CDRC Resource Launcher to complete your assessments. For guidance on how to access all CDRC resources, please see the instructional video for this. After launching the template, you'll see something similar to this first page. The template will be tailored to the patient. It will tell you whether they are on primary or secondary prevention or if they are eligible for either. The template will also intelligently tell you whether the patient is prescribed a low or moderate potency statin when they should be on a high intensity statin. The next panel will show the most recent blood results. By clicking on the arrow here, you can see all the previous results in the record for this patient. You can code whether a statin has been offered or declined and print patient information leaflets to give to the patient. The template will tell you if a cholesterol target has been set and whether this target is being achieved. If no target has been set, you can use the guidance on the template to calculate a cholesterol target. A little reminder here, the target should be calculated from results while the patient is not on lipid-lowering medication. The next page details how to assess for familial hypercholesterolemia and when to refer. The next page details statin safety alerts. It reminds you if the test is required prior to statin initiation. This page is also tailored to the patient and will alert you if a CK check is required or if there is a history of liver cirrhosis or rhabdomyolysis, as seen here in red. The next set of pages are drug-specific, with guidance on contraindications and cautions and recommended doses. Again, these pages are tailored to a patient and individualized alerts will appear in red. In this example, cyclosporin is prescribed, so a dedicated safety alert in red appears. And also, there's an adverse drug reaction to atorvastatin noted. There is a drug-specific advice checklist to ensure patients are adequately counselled prior to starting their medication, and a section to add diary entries for the usual 3-month follow-up. There's also a link to further patient information leaflets. The last page also has guidance on the eligibility and referral for PCSK9 inhibitors, with the option to code referral if needed. I hope you found this instructional video helpful and that the CDRC can help and support you in managing lipid modification in your practice.